Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video, we're going to be discussing one of the special tests that can be used in the assessment of subacromial impingement syndrome, and that is Yocum's test, or just the Yocum test.
So, to perform Yocum's test, the patient's going to be positioned either in standing or sitting. The patient's going to reach across with one shoulder and grasp their opposite or contralateral shoulder. So if you want to get really specific here, my arm here is in horizontal adduction or adduction, and then the elbow is flexed, and I'm holding on to my opposite shoulder. Now from here, the patient's going to maintain their grip on that shoulder and elevate their elbow toward their forehead. So that will look like this. So actively elevate the elbow towards their forehead, and then lower back down, okay? That's Yocum's test. Now, what is a positive test? Well, a positive test is reproduction of the patient's familiar shoulder pain, specifically in the subacromial arch. Now, Yocum's test is a test for subacromial impingement syndrome, not for a rotator cuff tear. So, yes, reproduction of the patient's familiar shoulder pain. But what's really important here to help differentiate impingement syndrome versus a rotator cuff tear is the exact location of the pain. And this is where really talking to the patient and palpating becomes extremely important. Remember, if you actually have a rotator cuff tear, where is it most likely to tear? Well, first of all, the two muscles that are most likely to tear are the supraspinatus, which is the most common, and then second to that is infraspinatus. And they're most likely to tear near the insertion on the greater tubercle, so in their tendinous part. And so that would be more or less right around here. So this would be more for supraspinatus, and if we go back a little bit, that would be more infraspinatus, okay? So in that area. But that's not where impingement occurs. Impingement occurs in the subacromial space. So that's a little more proximal, kind of in this area here, okay? So when you're interpreting this test as positive or negative, you need to make sure you know where they're feeling the pain. If they're feeling the pain more at the insertion of supraspinatus or infraspinatus, it's not necessarily a negative test, but it may not indicate impingement syndrome. It may indicate a rotator cuff tear, and you should probably do some other tests like the empty can test or full can test to differentiate that further, okay? And a negative test would, of course, be there's no pain in this at all, okay? Now, there's some other impingement tests that we know. There's Neer's impingement test, or Neer's sign, and there's the Hawkins-Kennedy test. What you should notice here is that the Yocum test actually has the highest sensitivity of all three of those impingement tests. So that means that if you're looking to quickly rule out impingement syndrome, Yocum's test is actually the best of these three tests to use, okay? Now you'll notice that none of them have good specificity. Okay, so again, that's because this test could also be positive. It could reproduce pain if there's a rotator cuff tear. It could do it if there's an AC joint pathology. Okay, so these tests have very poor specificity. But if you're looking to rule out impingement syndrome, Yocum's test is actually the best one to use first. And then you can see after that, probably Hawkins-Kennedy and then Neer's. Okay. Now, specifically, Yocum's test has a sensitivity value of 79%. So if I do this test and there's no pain at all, there's a 79% chance that I do not have impingement syndrome. But if I do this test and it's positive, notice the specificity is 40%. There's only a 40% chance that I have impingement syndrome. Again, it could also be a rotator cuff tear. It could be an AC joint pathology. And that's where the pain location, talking to your patient and palpating, becomes extremely important, and then of course knowing your anatomy. So hopefully this video gave you a good understanding of Yocum's test and how it's applied and how we interpret the results. Make sure to leave a like, subscribe for future videos, and also hit that notification button for notifications for all videos in the future. Thank you.